In other words, how regularly you show up matters more than how hard you push on any one single day. Are you ready to get back to what you love after knee replacement? The Total Knee Success Podcast is your trusted guide with practical tips, evidence-based strategies, and no fluff. It's not personal medical advice, just solid education to help you manage pain, regain mobility, and get back to living the life you love. Let's dive in. Welcome back to the Total Knee Success Podcast. I'm Michelle, and I'm really glad you're joining me today. If you've been listening to episodes 33 through 35, we've been talking about timing, trade-offs, and the real risks of waiting too long for a knee replacement, if that's what you really need. Those conversations can feel kind of heavy because they ask you to think about change, uncertainty, and decisions you may have been postponing for months or even years. A very natural question tends to surface next, and maybe it's already been on your mind. What actually matters before surgery, and where should your limited time, energy, and attention really go? This episode is the first half of a two-part conversation focused entirely on preparation before knee replacement surgery. And today we're talking about the foundations that consistently show up in both research and real-world rehabilitation data as shaping how recovery unfolds. By the end of this episode, you'll have a little more clarity about which preparation priorities truly influence outcomes, why focusing on a small number of foundations matters more than trying to do everything, and how this sets the stage for part 2, where we'll talk about what matters far less than people are often led to believe, and why letting go of that noise can protect your progress. A quick note before we go further, this podcast is for education, and it's not individualized medical advice. Your surgeon and physical therapist should always guide decisions for your specific situation. Preparation for total knee replacement does not mean doing everything. It does not mean chasing perfection, fixing every weakness, or turning the months before surgery into a full-time project. Preparation means focusing on a few things that reliably make a meaningful difference, even when life, pain, or motivation are a little inconsistent. For many people, that reframing alone brings a sense of relief. Strength is the most consistent driver we see when we look at outcomes before and after knee replacement. When people go into surgery with stronger quadriceps and glutes, and that's the thigh and hip muscles, a stronger overall lower body function, the early postoperative phase tends to feel more manageable and less chaotic. This is not about building muscle for appearance or chasing gym numbers. It's about having enough physical reserve to meet the real demands placed on you, standing up repeatedly, walking short distances many times per day, and tolerating exercises that are going to feel uncomfortable at first. In the early weeks after surgery, your body is dealing with swelling, pain, disrupted sleep, and unfamiliar movement patterns. If your baseline strength is already low, every task feels harder than it needs to. When strength is higher going in, those same demands require less effort and allow earlier participation, even though the process is still work. The differences come down to where you start. And research supports this pattern. A large systematic review published in 2022 found that structured rehabilitation programs improve knee function before surgery and during the early postoperative phase. In practical terms, people entered surgery with more usable strength and coordination, which made early movement and participation in therapy feel achievable rather than discouraging. While these advantages do tend to narrow over time, that early window matters because it shapes confidence, movement quality, and willingness to engage. When the early therapy sessions feel doable instead of defeating, people are more likely to show up consistently, attempt appropriately challenging tasks, and avoid fear-driven guarding that can slow recovery. This is one reason early progress has an outsized influence. It affects behavior, not just physical ability. And large-scale rehab data reinforce this idea. An analysis of more than 12,000 patients published in 2023 showed that when clinics followed a clear, function-focused care guideline after total knee replacement, patients achieved better functional gains with less variation across clinics. The takeaway is not that one protocol fits everyone, because we know that that's not true. But prioritizing strength and function creates a more reliable baseline across very different people, clinics, and circumstances. A muscle isn't meaningfully strong if you can't recruit it. In many cases, what shows up as weakness reflects impaired activation rather than lack of muscle tissue. Long-standing knee pain can inhibit how well the quadriceps turns on, and that inhibition frequently persists after surgery. Many people describe it as knowing what they want the leg to do, but they feel like it just won't cooperate. This can be deeply frustrating, especially for those who were more physically active before knee pain began to limit them, which, frankly, is most people. This is where neuromuscular electrical stimulation, or NMES, may be helpful for selected individuals. A 2024 clinical commentary published in the Journal of Orthopedic and Sports Physical Therapy revisited the role of NMES and emphasized that when voluntary contraction is limited, this targeted stimulation can support quadriceps activity and early strength return. This is very important. Early weakness, meaning the weakness seen right after surgery and through the first several weeks, can reflect a combination of pain, swelling, reduced recruitment, and real loss of muscle tissue, not just one factor in isolation. NMES is not necessarily for everyone, and it's not a shortcut. Its role is to address inhibition, meaning that the muscle won't contract when you want it to, and that prevents the muscle from being fully recruited. So the muscle tissue that's already there, it can be used more effectively in the early weeks after surgery using NMES. And this is why preparation before surgery isn't just about building strength, but it's also preserving how much of what you have so that you'll be able to use it after the surgery. Better going in, better going out. Walking capacity is another powerful indicator of readiness. Walking reflects your ability to use your strength, your balance, your endurance. It reflects pain tolerance and confidence all at once in one hopefully smooth movement, but oftentimes not so smooth if you're going in for a knee replacement. It also mirrors the basic demands of daily life after surgery, making it one of the most practical and transferable ways to prepare. If walking has gradually narrowed to the bare minimum, just enough to get through the day, gently expanding your tolerance before you go in for surgery can be one of the most effective forms of preparation. And this doesn't mean pushing through severe pain or chasing step counts. It means just a gradual rebuilding of trust in your ability to move, rest, and repeat that cycle reliably. Now, range of motion does play a role, but it's often overemphasized. Severe stiffness should absolutely be addressed with your care team, particularly if extension is limited. And extension is when you have your knee out straight. Chasing a perfect bend before surgery is really rarely the best use of limited energy. Strength, walking capacity, and overall function appear far more consistently in outcome research than a single range of motion number. So don't hang your hat all on one range of motion number. One important myth to address before surgery is the fear that exercise is damaging your knee. And a 2025 JOSPT, that's the Journal of Orthopedic and Sports Physical Therapy commentary by Bricca and colleagues, found no evidence that appropriately prescribed exercise accelerates joint degeneration in knee osteoarthritis. Pain does not automatically mean damage, and avoiding movement reliably leads to loss of function. This belief alone keeps many people stuck in cycles of fear and decline. Consistency matters more than intensity. A 2022 study showed that adherence patterns strongly influence activity levels after knee replacement. In other words, how regularly you show up matters more than how hard you push on any one single day. The habits you practice before surgery, showing up regularly, adjusting when needed, and continuing even when your motivation dips a bit, are the same habits that make the early demands after surgery a little more manageable. So stick with it. That brings this back to the basics of daily function. Being able to stand up from a chair, walk for a sustained period, or manage stairs safely isn't about training for extremes. It's about preparing for the exact demands your body will face after surgery. So check in with yourself here. Can you stand up from a chair without using your hands most of the time? Can you walk for 10 minutes at a comfortable pace? Can you manage a few stairs safely with a railing? These are the kinds of tasks therapy will ask you to do. These are the kinds of tasks you may be asked to do early on after surgery, and they're all trainable before surgery. If this episode has gotten you thinking about getting ready for surgery and you want a clear, structured roadmap for how to prepare before knee replacement without overthinking, my upcoming book, The Knee Replacement Game Plan, focuses entirely on the pre-surgery phase. It breaks preparation into realistic priorities so you know exactly where to focus using the same evidence-based principles that we've been talking about today. You can learn more about the upcoming release at totalkneesuccess.com, and you can use the link in the show notes to be notified when the book is released. So before we wrap up, here's a quick review. Getting ready for knee replacement isn't about checking every box or fixing everything at once. Across the evidence, a small number of foundations show up again and again, going into surgery with usable strength in the thigh and hip muscles, maintaining the ability to walk and tolerate everyday movement, addressing factors that limit how well muscles can be recruited, and building habits of consistency rather than bursts of heavy effort and then significant fatigue afterward. The consistency is really more important. These are the foundations of this episode. The thing to keep in mind is that preparation is not about doing more, it's about doing what supports you. In part 2, we'll talk about the concerns that tend to take up a lot of mental space, but end up having far less impact, so you can focus your time and energy where it actually helps before surgery. I'm Michelle, and this has been the Total Knee Success Podcast. This podcast is for educational purposes only. Discover more at totalkneesuccess.com, and be sure to subscribe and share, because every step forward takes you closer to living the life you love.